Good afternoon. My name is Mike. I'm one of the RNs here at the VA hospital in San Antonio. I work on the psych unit. Today I'll be doing a little short little presentation here on albuterol, which is used for asthma. My main focus today is how it's used for asthma. It can be used for COPD, but my presentation is going to focus more on the asthma aspect. What kind of drug is albuterol? It's a bronchodilator. It's a drug. It's a short-acting bronchodilator, which is like more for like helps more with the emergency aspects of the attack, like an asthma attack, something like that. So the mode of action, the dilation of the airways is the primary mode of action with albuterol. There's a buildup of mucus, they have bronchospasms, and swelling of the airways contribute to the shortness of breath and the wheezing, which is associated with asthma. Today, three of the objectives I want to go over today are discuss the pathophysiology of albuterol treatment for asthma. Number two, explain the pharmacological effects of albuterol. And number three, explain what the first-line treatment for asthma exacerbations would be. So let's talk about the content process, the pharmacological process. So albuterol acts on the beta-2 adrenergic receptors, which are associated with the smooth muscles, and these receptors combine with the albuterol and provide relief for the asthma sufferer. So the receptors of the beta adrenergic agonist drugs are stimulated by the enzyme adenylate cyclase. The relaxation of the bronchial smooth muscles is associated with inhibition of swelling and constriction of the airways. The smooth muscle restriction is alleviated with the short-acting bronchodilator. So basically, they get real constricted. They use the albuterol, and it just kind of releases that constriction, so it's a lot easier to breathe. The smooth muscles restriction is alleviated with, like I said, the short-acting use of the bronchodilator. In this case, albuterol. Bronchodilators such as beta-2 agonists, like albuterol treatment, help to alleviate those exacerbations. Albuterol treatment is the first-line treatment medication used to alleviate or diminish the classic inflammatory issues associated with acute asthma attacks or exacerbations. So, like I said, albuterol is one of the first-line treatments they use when they have those bronchoconstrictions, there's inflammation, and like an asthma attack or acute exacerbations. Some of the abnormal pathophysiology associated with asthma, asthma involves inflammation of the airways, like I said earlier, edema, and bronchospasms of the smooth muscles, which causes the airway. That's what causes the airway problems, caused by the reactions from like allergens, airway irritants, possible medication reactions you could have that could cause an asthma attack, and exercise can play a major factor in the trigger mechanisms associated with the bronchospasms. Sometimes the cold air, like if you live in the north in the colder environments, that cold air could cause those exacerbations and those attacks. Mucus secretions also play a role in the edema and inflammation of the airway smooth muscle. You get like a hyper responsiveness from all that mucus buildup, could cause a reaction also. The shortness of breath, the wheezing, and chronic cough are interactions that occur due to the bronchial inflammations and persistent characteristics of airway limitations that are involved with acute asthma exacerbations. So you'll get that wheezing, that shortness of breath, like I said, and that chronic cough. That's like kind of a classic symptom, a chronic cough, because you get that inflammation in there, and you got to reduce that inflammation so they can breathe a lot better and have better air exchange and oxygenation and better airway exchange. Some of the side effects, of course, with all medication, there's always side effects. The side effects associated with the use of beta-2 agonists, such as albuterol, could be swelling in the facial area. You can see some swelling in the face. Rapid heartbeat, anxiety is a possible side effect. Like I said, cough, the chronic cough. Some people encounter nausea. Could be another issue associated with the side effects. Also, could have possible breathing difficulties. And what else can you have? Pruritus, like itching. Some people itch. They feel like there's bugs crawling on their skin. They get real itchy, and that's a classic sign there's something going on. Discontinue that. Discontinue the medication. They feel like that. And issues with swallowing. That's real important. If you feel like you can't swallow, obviously you're having a reaction. Discontinue the medication right away and get medical attention as soon as possible for that. Some of the modifications, restorations with albuterol treatment. The use of albuterol treatment is a medication that it won't cure asthma. There's no cure for asthma. All we could do is just help alleviate the symptoms and the exacerbations. But it will help restore the normal airway function and minus the inflammation, because like the inflammation would be more with a corticosteroid. But mucus issues and smooth muscle bronchial constrictions, that's where the albuterol really helps out as far as the helping with the airway, getting better oxygenation. Some of the contraindications that we might see, there are some contraindications to using albuterol treatments, such as like women who are pregnant or breastfeeding probably would not want to use the albuterol. Individuals diagnosed with hypothyroidism, there could be reactions with that. Also, you probably don't want to use the albuterol in that case. Breathing difficulties, like we spoke about earlier, if you're having breathing difficulties, you don't want to use the albuterol. And individuals diagnosed with diabetes, and if someone has a history of seizures, they should exercise caution and restraint when using the prescribed albuterol treatments because of the possible reactions that could take place. The learning environment today that we're going to be in, the teaching environment is a classroom environment like we're in now, where the students will be taught about asthma and the exacerbations that are from asthma and the treatment, which is albuterol. We're talking about albuterol today. The age range today is anywhere between 18 and 70 years old. So the audience will be all nursing staff, new hires, seasoned professionals, and management. The educational level of the staff. The educational level is anywhere from associates, bachelors, masters, prepared nurses. The nursing educational level will vary greatly from the new graduate to the very seasoned professional. So there's a wide range of people in this classroom. Some of the evaluation criteria of learning. The evaluation process for this learning activity will be a short, like a 10 question quiz. Well, I'll just go over what we spoke about earlier. Just kind of do a rehash of the albuterol, the pharmacological effects, pathophysiology, the uses, stuff like that. The questions, it'd be more like an open discussion forum. Not real technical. It'd be like, less stress, so we could just talk about it, ask questions, more like a learning environment where it's not a lot of stress. Open format, like I said, question and answer, which is probably one of the best, easiest ways for the students to learn, and they could kind of recognize what's going on. So with the bronchodilators, like I talked about, so what do you think some of the questions they might ask me? Well, let's go take a step back. Let's talk about the expected outcomes. So the student will have a thorough understanding of how the medication albuterol interacts in the lungs to alleviate the exacerbations of asthma. Number two, the student will have a better knowledge of how the bronchodilator albuterol functions pharmacologically, like we spoke about earlier. The student will identify what the first-line treatment for acute exacerbations of asthma would be. We talked about albuterol for first-line treatment. Some of the links to the objectives. The content discussed supports the individual content of understanding the pathophysiology of albuterol treatment for acute asthma exacerbations. Figuring out the pharmacological effects of albuterol and how the medication works in the body to alleviate the effects of asthma, and knowing what medication is used in acute asthma attacks helps the nurse evaluate the first-line treatments, methods, and make informed treatment decisions related to treatment objectives, which would be albuterol for the first-line treatment. So some of the questions, what would some of the questions be the student might ask? How efficient is it? What's the efficacy of albuterol treatment? So albuterol treatment is very efficient in alleviating the narrowing of the airways and providing better oxygenation and ability to move air in and out of the lungs by allowing the airways to relax and the spasms to be reduced with less exacerbations. Another question might be asked, how safe is it? Generally, albuterol is safe and effective medication, but like with all medications, you have to take caution. There's always side effects with every medication. Third question a student might ask me is, what's the cost? Average cost is about $60 for the pump, for the albuterol pump, but that's just like the regular cost. But usually when you have your insurance, you'll just pay a copay. So I would say anywhere from maybe $20 to $40, depending on your insurance and your copay. So generally it's pretty cheap medication, but very effective, and it really helps with the asthma attacks and exacerbations with asthma. Well, I hope you guys learned something today. We went over the content, pharmacological, pathophysiology. We talked about albuterol being a first-line treatment. We went over the questions, expected outcomes, and like I said, we're in a very calm environment. Just ask questions, question and answer session, and I hope everyone learned something. Otherwise, have a great day, and God bless.